Hi, I'm Shanna Snow. I'm an obstetrician and gynecologist working at NorthBay Center for Women's Health. I told my mom when I was a little girl that I wanted to be a pediatrician and deliver babies. And it wasn't until later that I figured out that that's what an OBGYN does. But once I found out what else was involved in that job, surgery and clinic and taking care of women throughout their whole lifespan, I knew absolutely that this was the job for me. I work with women in women's health care. I span all of ages from young to elderly and do everything from primary care in the office all the way up to delivering babies, obviously in labor and delivery, through surgical care and helping with menopause for women in their later years in life.
How many weeks are you again? 32.
Most patients describe me as very easy to get along with, easy to get to know. I think they feel comfortable when they come in, or if they don't right off the bat by the end of the visit, they generally say that I put them at ease and they feel more comfortable telling me about their issues and problems. I also have been told that I am the first person that's ever truly listened to them, and I think that that is really important, and it makes me feel good because I do want to listen to my patients and find out their full story and try to help them from the ground up rather than just fixing one isolated problem at a time. The best part of my day, the easy answer is delivering a baby. I mean, there's nothing better than that. It's such a miracle and it's such a happy time in people's lives, so it doesn't get much better than that. One of my favorite stories and patients from my past was a patient that had tried repeatedly to have a child and had multiple miscarriages and came to me kind of at the end of her rope. We were able to achieve a pregnancy through some pretty basic things that a lot of physicians don't look at, but that I'm really into and think are important, including some nutritional changes and dietary supplements that we added, things that are maybe not quite as mainstream, but in this case it worked for her and she was able to get pregnant, carry that pregnancy all the way to term, and I delivered the baby, and it was one of the most exciting times in my life, and we actually cried together at the delivery because we had tried so hard to get her to this point, and there's just nothing better than that in somebody who feels like they have nowhere else to turn.